Okay, so hello, Dr. Lawson.
Good morning.
So we're talking to Dr. Jessica Lawson with Lawson Family Dentistry. My name is Greg Thompson. I'm with Accelerate ActionCOACH Business Coaching. And we want to just spend a few minutes, Dr. Lawson, and talk to you about your business and your practice and tell people what Lawson Family Dentistry is all about. Is that okay with you?
That sounds wonderful. Thank you, Greg.
All right. So how did it all start? How did Lawson Family Dentistry come around?
That's a great question. Well, I came out of dental school. I worked for some other wonderful dentists and also even experienced the corporate or franchise model. And just decided there had to be something better for the patients. I struggled when I was younger with whether or not I wanted to be a medical doctor versus a dentist, knew I was going to be something in healthcare, but really wanted the small private practice model that we all grew up with, where I knew my patients, they knew me, I knew their families. We had that long-term connection and practiced more of a medical model.
Okay. So how long has it been since Lawson Family Dentistry has been up and going?
That is a great question. We are going on year 14 here this summer.
Congratulations. That's awesome.
Thank you.
That was very good. Very good. So let's talk about who would be an ideal patient. Who does Lawson Family Dentistry hope calls them up and walks in their front door?
Of course, we will see anybody, Greg. We provide a wide range of services, but we really pride ourselves on those who are looking for total health. We treat pain. We reconstruct patients after they've had other health issues, apnea, gastric reflux, and their dentitions have just been destroyed and nobody's ever really been able to tell them why. So we work with a team of medical specialists, first of all, to make sure that the health issue is resolved so that anything I provide them with will last and not be destroyed. Teeth were. But we even start seeing kiddos as young as one or first tooth and really start educating the parents and prepping them for these future health issues and how they can prevent them, widening their palates, promoting correct craniofacial growth so that they hopefully don't become these adults with sleep and GI issues. So.
Okay. So really, all ranges. You appreciate and enjoy and welcome all ranges, it sounds like.
You bet. I would say most frequently that is either those kiddos or even kind of middle-aged male and females who have maybe recommitted to their health and are ready to do something, with whether it be their teeth, their airway, their arch form. But yeah, we see all ages.
Oh, wow. That's awesome. So 14 years, obviously you're around through 2020 and that crazy year that was. So tell us, how have things come around after 2020, and were there issues that you had to initiate, implement in 2020 that you're still using in today's practice?
The good news is a lot of things have relaxed recently in healthcare. In dentistry, we had been practicing these safety protocols since the 70s. So we didn't have a ton of changes other than, a lot of us might be promoting more of a curbside check-in, spending more time with our patients, doing more in a visit than we used to, instead of kind of getting them in and out and drilling and filling. A lot of patients prefer to do one long visit or take a half day of PTO. I do find that a lot more patients are wanting sedation of some sort, whether it be laughing gas or something a little bit stronger. Again, maybe patients let their health lapse for a couple of years, and so they have a lot more going on, or are embarrassed or anxious about it. So that's what my team is great at, is putting them at ease, getting something done in a half day and having them mildly sedated where they feel like they were only here for an hour. But the biggest thing I can say is a lot of emergency dental care right now, a lot of cracked teeth, TMJ, unhealthy periodontal disease, gingivitis, because people just waited or couldn't come in. So yeah, we're just looking forward to continuing to welcome people back and get them healthy, get them back on track so that they're doing more preventive medicine than, reparative dentistry, if you will.
Yeah. So did you get actually shut down then in 2020?
Yes, for 8 weeks.
Okay.
So we provide services only. Mhm.
Okay. Okay. And so are you finding, so this is 2 years out now, are people starting to come back around again? Are they starting to take care of their teeth again? And
You bet. In fact, the kind of the fun thing that's happened is because so many people are on Zoom calls and looking at themselves all day in these meetings, I'd say cosmetic dentistry is at an all-time high right now. A ton of, Invisalign type cases, so orthodontia, veneers, they're really taking pride in their appearances and their health. Yep.
oh, makes sense. Totally makes sense. You mentioned a little bit about your team. Tell us about your team. Who all do you have on staff there?
I have a wonderful office manager who used to be married to an oral surgeon. So she's a wonderful addition because she really understands the importance of replacing teeth with dental implants, making sure that patients aren't losing bone or losing the opportunity to have teeth someday. So she's been a great one to build our implant practice because I do place implants as well as restore them. I've got 2 talented dental assistants, and they actually started in nursing. So they love patient care. They truly want to be here for the profession. It's not just a paycheck to them. And they are both working on getting their enhanced licenses so they can do more with patients, which is wonderful because it allows them to design and put things in the mouth and take pride in what the patient leaves with. It's not just me. And then I have one incredible full-time hygienist, very gentle, does a great job connecting with the patients. And we are actually in the process of interviewing our second hygienist. So yes, the schedules are filling again.
So your message to people would be it's fun to come to Lawson Family Dentistry. No fears, only fun.
You bet. You bet. We're like family here. We try to have a good time. Don't take ourselves too seriously. And most days we've got the NCAA tournament playing right now, music on in the background. Lots of fun stuff going on around here. And occasionally I've got a little dog. Sometimes we might even have a little therapy dog running around here. So yeah, we try to enjoy ourselves.
Very cool. Very cool. Is your profession challenged with recruiting of people? Are young people getting into the dentistry profession, or is it older people getting out and a hard time replacing them?
That's a great question. So I would say the applicants to dental school, that's at an all-time high. I think graduates have realized it's just such a great life work balance. You get to be a healthcare provider, yes, yet be artistic and creative at the same time. No day is ever the same, a lot of variety. Our challenge right now is probably hygienists. A lot of them retired during the pandemic. Assistants are hard to come by as well, but at least with assistants, we can train somebody off the street. If they've got the right work ethic, the right desire to care for patients, they're patient focused and patient centered. We can train anybody to be a fabulous assistant. But yeah, we need some great hygienists entering the field now that we're pulling out of this thing, because their relationship with the patients is, ongoing. It's a really long-term one. And that's who the patients look forward to coming to see. So.
Sure. Okay. So there's a saying out there that smart people learn from their mistakes, but wise people learn from other people's mistakes. So you've been an entrepreneur for 14 years now, owned your own business. What it would be some words of wisdom or some learnings that you have come about the hard way that you would pass along to maybe a new entrepreneur or younger up and coming entrepreneurs?
Great question. With great rewards come great risks. I would say that for sure. I opened right after the stock market crashed in 2009, and I just held tight to my vision, my work ethic. I stayed involved in the community, whether it was church, my kids' school, just volunteerism. I think putting yourself out there, making people see that you're active, that you really just care about people and not just your career and your office and your income is a huge part of it. But staying well educated, you have to be a lifetime learner. and want to always challenge yourself and admit to your own mistakes, be very humble. I've attracted some of the best employees because I'm honest, and I tell them, hey, I have learned I was not a great leader 10 years ago, but I think some of it comes from being a mom too. I've gained a lot of patience, and I'm a very good teacher and mentor. And I just continue to read and challenge myself and learn. So,
Oh, very great words to live by. Very good. Thank you. So how does a person get a hold of somebody there and get an appointment and come in and see your team?
well, you can certainly call during our office hours. Our phone number is 515-278-4366. But I also keep a close eye on our web chat. We've got a web chat on the homepage on our website at lawsondentistry.com. And so I'm addressing emails all weekend. Sometimes parents just want advice on how to get their kid to choose a healthy diet that helps them grow and thrive. And sometimes it's an emergency patient reaching out to see if I can get them in first thing Monday morning. So, yep, I'm usually reachable pretty much 24/7, except when I'm sleeping. So,
Well, fantastic. Well, Dr. Lawson, congratulations on your practice, and that always bugged me why they call a practice, because obviously you're a professional. So I don't get the word practice when it comes to law firms or physicians. It's like, no, you're not practicing. You're the real thing. You're professional. So congratulations on 14 years, and I wish you much continued success, and thank you for your time today.
thank you very much for the opportunity.